people, welcome back to another episode of Conversations with Jen. Today's guest is another special guest. I feel like I say that all the time, but all of my guests are special. As you can tell, I am still in Jamaica and I'm speaking to people impacted by sickle cell in Jamaica. And so my next guest, I'll let her introduce herself and what she does, but we have, I would say, been connected over the years, and more recently we've been able to partner and work on some really important initiatives. So thank you. Please introduce yourself and what you do.
Okay, well, thanks so much for having me, Jenica. I'm Camille Daly, one of the founders of the Sickle Cell Support Foundation of Jamaica and the president of the foundation.
Okay, amazing. So just a nice accolade there of like what you do. And I want to get into more detail your work with the foundation. But beforehand, what I kind of like to do with most of, my guests on the show that have sickle cell is to find out what your journey has been like living with sickle cell. So from your childhood experience going up, what's that experience been like?
Well, I think it's been challenging, but, I've been fortunate to have a really supportive family. So, I've been able to sort of cope with all the illness. When I was younger, I was sick far more frequently, Okay. So I missed a lot of school, but I had that support. Fortunately, both my parents are actually teachers. Okay. My father left the classroom. My mother was a teacher the whole time I was growing up. And so, she was very supportive and encouraged me to always, ensure I got back all the notes that I'd missed from class, and always to try to ensure I kept on top of my schoolwork, which is so important. I was fortunate. I had supportive friends also, yes. My best friend, Arlene Bailey, I always acknowledge her, especially during, let's say, first, about third form. Yeah, she would always be there to help me catch up with notes or, explain stuff. So it's really important to have supportive friends and family to help you to bounce back, each time you have a painful crisis or some health challenge.
Do you think that your kind of experience growing up with sickle cell impacted at all with kind of like your work or the career choice or anything that you did kind of in your later years?
Well, I think that my experiences really taught me the importance of support. Yes, and as I got older, I met other persons with sickle cell who really didn't have much parent support, much family support, and they did really poorly in school and, were having a challenge, finding work and so on. So I think that really made me more focused on the fact that really there needs to be some organization to help persons with sickle cell. So I think by the time I had finished high school and got into my first year at university, I was clear that, we need to start something. And so I went to Professor Sargent, who was at the time head of the sickle cell unit on campus. And he introduced me to Maureen Wright, who also was on campus. She was doing a degree in mass communications. And we both linked up and said, okay, we want to start an organization that will both raise awareness about sickle cell disease as well as support persons with the condition. Trying to help them to manage the condition from an early age, so that the whole experience with school isn't so traumatic and that, their education outcomes are much better.
So your main motivation for setting up the Sickle Cell Support Foundation of Jamaica was basically because you realized how important your support systems were, and I guess that not everybody had the same level of support?
Right, exactly. I realized that many of the persons that I met at the sickle cell unit were alone. Their families kind of saw them as a burden, and, they didn't really provide much support. And I thought it would be good if we could have an organization of, affected families and persons who could then, sort of provide that support, especially if there was not much family support, And of course, raising awareness, because, there was a really, I would say a major stigma attached to sickle cell, that persons with sickle cell were hiding the condition. They didn't want to let anyone know they had the condition. Persons were being discriminated against, both at work and even also sometimes in the school community, people in the school community thought sickle cell would be catching or contagious and not wanting to associate, with other, they wouldn't, like some children would report that, other children wouldn't want to play with them because they have the sickle cell and want to catch a sickle cell and all of this nonsense.
Did you experience any of that yourself, kind of growing up?
No, not at all. Well, I didn't, how should I put it? I did not broadcast that I had sickle cell to the entire school community. I told my close friends,
Right.
But basically, I was fortunate. I didn't have anyone scorning me and saying, I didn't have anyone who would not want to be my friend because I had sickle cell. No, nothing of the sort. No, not at all.
Okay. So in terms of the work that the foundation does, what does that look like? How did you kind of start and what do you do to kind of keep going? Because you've been, how many years now has the foundation?
Right, this is our 30th year actually, yeah.
And you have been the co-founder of the foundation for that long?
Yeah, Morit and I, we started it in 1992. We met in 91 and our first year at UWI and it was launched in October 1992.
Wow.
And I was 19.
Since then, you've been a part of the foundation, advocating, pushing for it.
Yeah, pretty much. I have been at the helm, in terms of leadership role. But the foundation has had periods, where we've had more support than others in terms of persons being volunteers, because we really couldn't afford to pay staff, so it's really a volunteer organization. But sometimes we've had to we've had a part-time admin assistant who we've paid to help us, but it's been a lot of work, but it's been, very rewarding seeing that over time, the Ministry of Health has improved in their whole acknowledgement and inclusion of sickle cell disease. So sickle cell disease is now part of the Ministry of Health's strategic plan. And we can take some responsibility for that because we actually, in our first year, we lobbied the Ministry of Health to restart newborn screening of babies. Yeah. Yes, when Dr. Carl Blythe was the Minister of Health back in '93. And they said, yes, they would restart. And in fact, after about 2 or 3 years, they did restart newborn screening. Well, unfortunately, they didn't do it nationally. So they've begun it at Jubilee, Victoria Jubilee Hospital, UWI Hospital, and Spanish Town Hospital. Okay. Yeah, so for quite a while, we said, well, aren't you going to expand it nationally?
But eventually
Eventually. By 2015, they were more or less island-wide. And now they've actually included private hospitals, so babies born privately. So I feel happy to know that we lobbied for that. Our advocacy also included lobbying for persons who attend the sickle cell unit to be treated like public patients, because many patients would receive prescriptions for medication which, because they're unemployed, have no health insurance, they couldn't afford these drugs. So, some would come to us in the foundation for help, and we actually do help as part of our ongoing activities, help patients pay for medication. But we wanted to have it so that if you come to the sickle cell unit, you could take your prescription to a public free pharmacy, the drugstore pharmacies. And that's something that we lobbied for along with Professor Knight Madden, and that happened in about 2020. Yes.
I think I remember seeing
that. We met the Minister of Health, Dr. Christoph Dunning, I think it was October 2019, and sometime in 2020, the cabinet passed it. And it's been a little bit, sort of bumpy. The implementation is not always smooth. We still have to sometimes ask the ministry to remind pharmacies that
they're supposed to.
Yes.
So but the whole idea around that is that basically they can get the specific medications that they're on for free.
Right, because the government brings in certain medications for all persons who attend public hospitals. Because generally, persons who go to public hospitals or public clinics are from a low-income background.
Okay.
So they... if you had sickle cell and you were attending, let's say, Maypen Hospital, you could go to the drugstore attached to Maypen Hospital and get your drugs. But if you're in Kingston, the sickle cell unit patients were being treated like private patients, so we couldn't access the service.
So now everyone can get access to the medication.
Yes, thanks to these efforts, we have done that. So we're happy about that.
You've been quite kind of at the forefront of a lot of changes that have happened. What is next for the foundation, for you?
Well, right now we decided for our 30th year we wanted to do something really special. So we have launched last month our scholarship program. So the scholarship program will have 3 components. So there's a tertiary scholarship valued at $450,000. And that, for right now, we're starting with 1 tertiary student a year. And then there will be 3 bursaries for persons who, as I would have explained to you, didn't do well in high school because they didn't have that support. And they have no CXC passes, no subjects to help them move on.
So it's like extra support with like after school?
Right, no. It's actually, because these are now adults now, they've moved out from school. So basically, they would be able to receive funding to do short courses, like maybe at Hart or VTDI, other training institutions, or if they wanted to go and do the subjects again privately. So the bursaries are to help persons get a second chance. If they didn't really succeed in high school, they can still try to get back on track. And then we also have Mr. Tyrone Wilson, who is the CEO of I Create Institute. Yeah, he also has sickle cell disease. And he has come on board to offer sponsorship for his certificate in digital skills. So there'll be certain courses like social media marketing and things related to the internet. So students who are, or persons who are interested in kind of having that type of career, they will be able to access one of 3 scholarships he's going to provide. So for this year, we should be hopefully helping about 7 persons through the different components.
So it's all about helping, again, supporting people living with sickle cell,
and
empowering them to kind of get work, get into positions, help them along their way.
Yeah, that's the idea, because it's really important that they become self-supporting. Yeah, because living with sickle cell, as you know, can get very expensive.
Well, I can't say that I know that much because obviously I'm from the UK.
Personally.
Yeah, so we have the NHS, but I know that it can be, for people outside of that, especially if you don't have kind of the support of a free healthcare system, so to speak.
Exactly.
What motivates you to keep going then over the past 30 years? What's kept you going?
That's a good question. I think that what I've been doing is basically what I just feel comes to me naturally. I'm called to do this. I think that, it's part of God's role for me here on, in this life. I'm constantly thinking about ways that we can, expand our support and try to do things that will really make a meaningful difference in the lives of people. Yeah, because I think what's been, I guess, of concern is that sickle cell has always been this kind of neglected disease, and people who have the condition tend to hide it and, tend not to really lobby for themselves, right? So I'm glad that we've been able to shine a light on the condition and to try and get more government resources being directed towards helping persons with the condition. So, yeah, I think that I'm hoping to find maybe another 5 years or so that I'll hand over to some...
Only 5?
Yeah, some very motivated person. I mean, yeah, to be honest, I can't believe it's 30 years already. I'm like, wow.
That's a long time.
Yes.
For someone like myself who's, it's been recent, it's kudos to you. Like, it's really good that you've sustained, you've kept going, and I'm sure that you've probably have hurdles and things like that you've had to overcome, so...
I think I just have to give God thanks that I'm alive, because, we were all told that, you're not going to live to see this age or that age. Yeah, so I'm grateful that I'm here, I'm alive, and, still able to contribute. But I'm looking for these, successors. I really would love to see the organization being island-wide. That was our vision, that every parish would have a branch of the foundation, but that hasn't happened yet. We'll see.
Who knows what the future holds?
Quite.
Before I wrap up, do you have any questions for me?
Well, first thing I want to say to you, Jenica, is
she's ready.
I've got to say first, thank you, because as you know, when I said to you, I need help with fundraising, we have so many patients who are needy. And just like that, you said, you're going to start raising money for me, and that donation you gave us over £1,000. Can I tell you? That saved us, through COVID. Can I tell you? Because of COVID, we didn't have our plays. We normally have benefits of the Basil Dawkins plays, at least 2 every year, and we couldn't have any. And so you were just a godsend. Can I tell you, girl?
Oh,
yeah.
Thank
you. I'm so grateful to you.
You're welcome.
And yeah, I really hope that we can collaborate more. I mean, and, work on more, cross-border, shall we say, initiatives for education and so on. But what I would say is I think you're ideal, because the last thing I saw online is that you were doing a blood drive. Yeah, and I think we need that here as well. So I think we need to collaborate on that.
I think it's happening, but my whole thing is just partnering, collaborating, seeing how I can help. I don't think that the wheel needs to be reinvented, especially when you go to some places. I've been to Nigeria, I've been to the Gambia, I've been around. So what's already there, I think for me, it's about how I can add to what's existing and just support what's already there. I don't have to,
I think what we need is to have all families, who have patients or have kids with sickle cell or members with sickle cell, they need to try to get people they know to ongoingly give blood. Yeah, because we started a sickle cell blood account, Yeah, in the 90s, we had a couple drives. And after that, guess what happened? The blood bank took it. No, the blood bank said, so what, you think we're going to sit down on this blood until a sickle cell patient calls us? No, somebody gets shot.
It has to get used.
Yeah, we're using that blood, yeah.
I think it's a process. Everything's a process.
That's what we need, like ongoing. I think that'd be really good to have that, ongoing blood drives. And I think also to more awareness in school, yeah? I think definitely more outreach within the schools is something that I want to do as well.
Well, we'll see how I'm sure that there's things that we can do. Like, I'm just here to help. It's something that I'm passionate about. Of course, I live with it as well.
Exactly.
And I think children, for me, are one of my main kind of motivations, so that they just have a different experience than I had.
Yeah, absolutely. Absolutely.
Thank you so much for joining me.
Yes, thank you for having me. I really appreciate it. And I really appreciate you and the support you've given us. Really, I do.
Thank you.
Absolutely. Absolutely.